Health Connection, medical assistance for all.
Hello, I am Dr. Praveen Gupta. I am the Director of Neurology at Fortis, Gurgaon. We treat various neurological disorders which move from epilepsy, stroke, headache, movement disorders, dementia. But as a doctor, it is imperative not just to prescribe medicines and treat patients. It is imperative to educate them so that we can prevent or diagnose disease in early stages, giving them benefit. And that's something that is very close to our heart, and that's why we are coming to you with this educational awareness video. So when we talk of nerve disorders, the most frequent disorder is headache. So if you have a head, you use your head, you will get a headache. About 15% of population suffers from migraine at some point of time in their life. That's why to talk of migraine is of great importance. And it is riddled by myths that migraine has no cure, migraine has no treatment, and that is why most patients will not look to take treatment. I am telling you from experience because I conducted India's first trial of a drug called topiramate in migraine, which shows that it is effective in migraine. So I am speaking from experience of that trial as I come back to you. We a lot of times think that if you have a headache or not eating food, not sleeping properly, going out in sun or stress, that's a normal headache. But how can there be a normal headache? No, a headache is a headache and it's a problem. So all such headaches are migraines, which we often neglect. So migraine, contrary to our expectation, can be on one side of the head, can be on both sides of the head, can be associated with nausea, cannot be associated with nausea. It has photophobia or light sensitivity, it has phonophobia or sound sensitivity as its accompanying symptoms. Unfortunately, migraine cannot be diagnosed by tests like MRI and EEG, and most tests in migraine are normal. So migraine is diagnosed by a doctor by a careful history taking where he understands your symptoms and figures out that these symptoms fit in with migraine. Almost 50 to 90% of headache disorders are migraine, and in migraine 98% of MRIs and CTs which are done for treatment are actually normal. Migraine is not a serious disorder. It does not impair your longevity, it does not impair your mentation, it does not take away your memory. But what it causes is severe uncomfortable headaches which compromises your quality of life, which can cause you to depress, which can cause you to miss your work days. That is why it is important to identify and treat it. Because of the accompanying nausea and vomiting, a lot of people feel that it is the acidity which is causing the headache, which is contrary to reality, where the headache is causing the acidity. So a lot of people call it gas wala headache. A lot of other people feel dizziness during migraine and they think it is a vertigo disorder. But dizziness with head heaviness can also be migraine. Pain starting from neck going to the head, which we think is cervical spondylitis, it can still be migraine. Right? So it is important to get yourself diagnosed. Now when you have migraine, the three important things are eat food on time, sleep on time, and avoid triggers. Frequently this simple thing can actually help you avoid medication. But if you get a migraine, it is not useful to delay the medication as people want to do, because migraine medicine works best at the onset, nip it in the bud, as they say. However, if your migraine comes more than 3 times a month and you want to take SOS medication, frequently SOS medicine will cease to work and the headaches will linger on, they will come more frequently, which we call as transformed migraine. So if you have frequent migraine, it is important to start prophylactic medications which are there available to treat migraine and not kill pain, medicines which are not painkillers as we perceive usually. So based on how you are, how your body habitus is, your doctor can choose an appropriate prophylactic medication which can bring your headaches down from 10 per month to 1 per month. Even if they are not zero, this is more than adequate relief. It improves your quality of life, immensely restores balance, allows you to enjoy your life, and makes you less sensitive to triggers. So there has to be a headache. If you use your head, there is going to be a headache. But for every headache, there is a solution which is cheap, easy and effective. You just need to find it. Thank you.
Special thanks to Mr. Sudhir Gopalia and the management team of Fortis Hospital in association with Health Connection.
Medical disclaimer: the information in this video is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. All content, including text, graphics, images, and information, contained on or available through this video is for general information purposes only. It is not intended as medical advice, and should not be relied upon as a substitute for consultations with qualified health professionals who are familiar with your individual medical needs. The whole sole purpose of this video is to make people aware of healthcare and medical knowledge and developments. We at Health Connection specially recommend you to visit an authorized physician nearby for medical opinion, medication, treatments, or procedures. For more details, kindly visit our website www.healthconnection.in, or if you have any questions, comments, or concerns, please do not hesitate to write to us at info@healthconnection.in.